an important topic of internal reproductive system. This uterus, mostly in the exams, they will ask more times, 10 marks, 5 marks they will ask. So, to prepare well, today we can deal with uterus. The uterus is a hollow muscular pear-shaped organ, flattened anterior-posteriorly. It lies in pelvic cavity. The pelvic cavity is nothing but lies in lower abdomen, between the bladder and rectum. Bladder is in front of the uterus. Rectum is back of the uterus. In between, the uterus is present. The most of women, it leans forward, that is called as anteversion, and it is bent forward, that is called as anteflexion. Most of women have anteversion and anteflexion. What is anteversion? That is upper body straightly towards the front, and anteflexion is bent forward the front, almost the right side of the vagina. When the body is upright position, the uterus is slightly horizontal, almost horizontal. That means the upright position, the uterus is straight. The uterus is about 7.5 cm long, 5 cm wide, 2.5 cm thick. Next we can see about parts of the uterus. Parts of the uterus, first one is fundus, second body, third one cervix. Next I will explain in the figure parts of the uterus. Fundus, body, cervix, vagina. This one is the body of the uterus. This one uterine tubes. The outer covering is perimetrium or peritoneum. Middle covering is myometrium. Inner covering is endometrium. This one cervix, cavity of cervix. This one internal opening of the cervix, external opening of the cervix. This canal is cervical canal. This one is vagina. Next we can see about fundus. Fundus is dome-shaped part of the uterus above opening of the fallopian tubes. In fundus only, the fallopian tube is opening. Next we can see about body. This is the main part. It is narrowest, inferiorly continuous with the cervix. Next we can see about cervix. This is the neck of the uterus. It is protruded through the anterior wall of the vagina. The opening into it at the external os. Actually, the external cervical opening into the vagina, into it in the vagina. Next we can see about walls of the uterus. The wall composed of 3 layers of the tissues. First one, perimetrium, myometrium, endometrium. Perimetrium. Perimetrium, this is its other name, peritoneum. Peritoneum is nothing but abdominal covering, outer covering. Peri is nothing but outer. Myo is middle. Endo means inside. Perimetrium or peritoneum, which is distributed differently on the various surface of the uterus. This outer covering distribute into the various surface of the uterus. Anteriorly, it extends over the fundus. Anteriorly means front, posterior, backside, lateral, sideway, superior, upper way, inferior, down way. First we can see about anteriorly. Anteriorly, it extends over the fundus. The body where it is folded and the upper surface of the urinary bladder. Actually, the urinary bladder in front of the uterus only present. The fold of peritoneum forms vesico-uterine pouch. Actually, this one pouch will form. This covering, one pouch will form, that is vesico-uterine pouch. Next, posteriorly, the peritoneum extends over the fundus, the body of the cervix, and it is continuous into the rectum to form the recto-uterine pouch. Backside is rectum is present to form recto-uterine pouch. Laterally, only fundus is covered because the peritoneum forms a double folded with the uterine tubes. In upper free border, the double folded is the board ligament. The board ligament is support the uterus. In lateral ends only, the board ligament will present. Then attach the uterus to sides of the pelvis. Because the board ligament function is to support the uterus. Next we can see about myometrium. Myometrium is the thickest layer of the tissues in the uterine wall. It means a smooth of muscles. Myo means muscles. Smooth of muscles, fibers interlocked with alveolar tissues, blood vessels and nerves. So myometriums contain alveolar tissues, blood vessels and nerves. But it is myometrium is nothing but smooth muscles will present. Next we can see about endometrium. This is an important one. This is consists of columnar epithelium containing large number of the mucus secreting tubular glands. It is divided into 2 layers. First one, functional layer. Second one is basal layer. The functional layer is upper layer and it thickens and become rich in blood vessels. In the first half of the menstrual cycle, the ovum is not fertilized and does not implant the layer shed down during the menstruation. Actually, during the menstruation time, the functional layer shed down if ovum is not fertilized. But basal layer not shed down during the menstruation. Next we can say about basal layer. It lies next to the myometrium. Next to the myometrium is a functional layer the basal layer. And it's not lost during the menstruation. It is the layer from which the fresh functional layer is regenerated during each cycle. During menstruation time, this layer is regenerated. That means regrowth will occur. Next, we can see about supporting structure of the uterus. Before class already I told structures. The uterus supported in the pelvic cavity by surrounding organs, muscles of the pelvic floor and ligaments. First one is broad ligament. Second one is round ligament. Third, uterosacral ligaments, transverse cervical ligaments and pubocervical fascia. This is supporting structure of uterus. Functions of the uterus. To retain the fertilized ovum during the development, an ovum when it is released from the ovary, it's conveyed along a uterine tube to the uterus. That means the fertilization occurs in the uterine tube, the place of ampulla, and goes through the uterine tubes and comes into the uterus. And the fetus embedded into the uterus. During the pregnancy, which is normally lasts about 40 weeks, the uterine sizes increase and the endometrium walls, that means internal walls, the walls become thinner but stronger, and this uterus rises into the abdominal cavity and goes into abdominal cavity. Normally the uterus is in pelvic cavity. At the end of the pregnancy, the uterus goes into the abdominal cavity because fetus grown. When terms has been reached, terms is nothing but 9 months plus 7 days. That period is called as term period. When term, labor commenced, labor started, the uterus contract, expel out of the baby through vagina, and the uterus returns into the normal size. That process is called as involution. That is about uterus.